Hi, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you key experts in the fields of nutrition, prevention, integrative, and lifestyle medicine for the individual, society, and the whole. And sometimes I do interviews, which I'm going to do today, and happy to do that. And sometimes I'll do a little video myself on a topic. But today's topic sounds kind of generic, but as I talk to people, there's a concern about it, and that is anxiety. Is there more of it, reasons for it, and non drug approaches to managing it? My guest today is Matthew Halma. He's a researcher and PhD candidate, and he can help me with the pronunciation of the Verger, University of
Vrij.
Amsterdam. How is it said?
Vrij.
Vrij. I was panicking on that one. Vrij, University of Amsterdam, at the Physics and Living Systems Laboratory. He is co-founder of the Open Source Medicine Foundation, which provides evidence-based protocols and recommendations for overcoming chronic disease. He's director of scientific research at the Independent Medical Alliance. That's where I kind of found him. And his expertise is singular molecular biophysics, evidence synthesis, and molecular biology. And he's talking to us from Honduras, which is in Central America. And the title and the reason that I came about and I want to talk to you is I came across an article written by you and your colleagues at the Independent Health Alliance on anxiety, a look at epidemiologic factors and alternative treatments in an international journal of depression, anxiety in 2025. And at first, okay, anxiety, but then I thought about it and I think I'm more anxious now going through the COVID experience and the way the world is, stability wise. Maybe there is more anxiety. And then obviously, we would like to have more alternatives than pharmacology to do that. So, welcome, Matthew. Thanks for coming on the day today. And if there's anything I can add to your introduction, please do.
Oh, that was very appropriate. So I'm happy with the introduction, and
Okay.
thank you for the opportunity.
And aren't you getting an MBA as well?
I completed that.
Oh,
That was an
that's
online degree. Uh,
got it. Was that in economics or was that in
it was
administration?
it was yeah, it was at it's a Brazilian institute, Fundação Ad, Administração de Empresa. It's the Institute for Management Studies, and yeah, that was a it's called a Future Studies program, but it was online. So
No problem. No problem. How many languages do you speak?
I'd say reasonably well, Dutch, Spanish, and French, and anything else is
That you have to
it's
do?
I muddle through. Yeah.
All right. Okay. Well, how did you get associated with the Independent Medical Alliance? How did that come about?
Yeah, it's a bit of well, it's not too long of a story. I guess I was interested in what you'd call alternative medicine for some time, even prior to COVID. And then, of course, when COVID happened, that was very glaring, um, yeah, a very glaring failure of the healthcare system. And I had done my previous academic training in biophysics, and so it was a bit outside of medicine, but not entirely. And yeah, I looked into things. I was following the blogs, and things weren't adding up with the official story, the official narrative. And so I went to a few events, and then I found those connections, uh, first through the World Council for Health, and that got me set up with meeting some people within the IMA, Dr.
Mhm.
Merrick, Dr. Barone, and we began working together, and you know we
Well, did you have a special interest? Were you already doing research on repurposed drugs or alternative approaches? I mean, you just came out of the blue and said, "I want to help," or what? How did you make the connection per
Uh,
se?
well, yeah, I guess I was a bit of an outsider to medicine. My previous research was, kind of academic, I guess you'd say, laboratory studies, single molecule biophysics, like working with optical tweezers to plot the unfolding routes of RNAs and different things. So I had some familiarity with molecular biology and these things, but even when doing my PhD, I was looking at branching out into more medicine. I guess I would say more impactful work,
All right,
rather than
then,
just laboratory biology.
got
And
it. Then COVID came and gave you a gift to be challenged, I guess.
yeah,
And
yeah,
there was
certainly.
all right. Well, let's get into the topic. Anxiety. Why did your group choose to just do that? Was it because there's a lot of alternative therapies to it, or did they go, "Wow, this is an upcoming problem that's more serious than we think"?
Yeah, to back up a bit, it's this is one article within a larger project, and you know I've called this project by several different names. I called it herbal equivalents for various pharmaceutical drugs, but that's not entirely accurate. Um, Basically, the broader project is really looking at what are the major causes of disease burden, and then picking them off one by one. Basically, that's the ideal, through publishing information on the treatment through natural routes or nutraceuticals. We for the purpose of publication, this is limited to nutraceuticals. That there's a bit on exercise. That's of course also a major help with anxiety. Um, but there's of course other conversations around anxiety, such as mental appraisal, which can really help. Um, but yes, to the short answer to your question is this is part of a larger initiative to characterize what are the alternatives to standard pharmaceutical treatment for the most significant diseases out there.
Got it. So, is anxiety increasing now, or did I just kind of make that up in the sense of we've had COVID, a very stressful time. We got wars going many different places. We have countries, changing and governments changing. So would you say that anxiety is higher now, or is it just anxiety's always been here and you're just coming up with some non-pharmacologic approaches to that?
Well, there definitely has been an increase over the course of COVID. That's estimated about 20% increase. Um, right now, the lifetime prevalence of an anxiety disorder, it's about 30% in the adult U.S. population. So it's yeah. To your question, it has been increasing.
Well, is there a gender relationship to anxiety? Do males or females have more anxiety? Talk about that for a second.
Yeah, women have roughly 2 times the incidence of anxiety as men.
Why do you think?
I
You won't get into trouble. There's no
yeah,
problem.
yeah. Um, yeah, generally, if you look at depression, it's also higher among women. Um, yeah, there's possibly some hormonal influences on that. A general difference in orientation. I think that it explains it well.
Yeah, twofold is pretty. It's a fairly large amount. I wonder if also men may not express themselves well enough to get diagnosed. Maybe I don't know. I don't know. But that's interesting. How about socioeconomic before we get into the non-pharmacologic approaches and lifestyle?
Yeah, generally the more there is to be anxious about, the more anxiety there is. So if among people who are making below the poverty line, they tend to have greater anxiety. As it's as you'd expect, it's harder to pay your bills and whatnot. Educational level, a higher education tends to be associated with lower anxiety. So there's definite socioeconomic contribution to
So
anxiety.
so was the so was the kind of the urge to look at non-pharmacologic approaches is because there's drugs for every kind of chronic disease, but maybe the drugs, SSRIs and things for anxiety and depression may be more harmful than the other drugs. Was that another reason to really look at anxiety? That these medications don't work that well, and then now you
Mhm.
got a problem.
Yeah, typically, standard treatment is SSRIs, sometimes benzodiazepines for more serious cases. All of these have significant side effects. SSRIs, there's not really the conversation of how to get off of them once you start. So that can be a major issue. Prolonged use, and that can affect your brain chemistry for decades, even after stopping. So, you know, if taking a different approach that avoids those compounds and their effects, that's definitely a priority. Also, just if you it's making treatment more accessible, because if you lower cost, then you expand accessibility. People are have greater ability to take their treatment into their own hands if they have correct information. Of course, I have to preface this. This is not medical advice. This is a scientific manuscript, which we hope can inform these decisions. But that's fundamentally up to someone in conversation with a medical provider.
I got it. Let me ask you about well, the first thing I thought about, because I've worked in an integrative medicine practice for 40 years, and so um, if you give a nutraceutical, it's not paid for. You got to pay out of pocket. So people can walk out with, if you have 5 different conditions and they don't do lifestyle well and they don't do diet well, which we'll talk about, then they can have a couple $100 a month easy out of their pocket because it's not getting paid for, where a pharmacologic agent might get paid for. But aside from that, uh, tell me, I see a chart here. So let's go over nutraceuticals, and then I'd like to do a little bit about lifestyle, exercise, and diet, or maybe let's do diet first. Because we can just summarize that, or you can get what are the pearls, or would you suggest someone to, as you look at the population and our chronic disease epidemic and processed foods, what recommendations did you all come up with for diet, just in general, for
Yeah,
anxiety?
generally, first reducing the level of processed foods. There's associations between high processed foods and levels of anxiety. So that's primary, and there's also a few supplements that can be added to that. These include ashwagandha, saffron, theanine, lavender, magnesium with vitamin B6, rhodiola, and lemon balm.
So let's stay with that. So do you have a favorites, so to speak, or what are simple for you to recommend, like ashwagandha? How does that particularly work?
Yeah, well, generally, these work through modulating neurotransmitters, through promoting parasympathetic balance. In the case of magnesium B6, it's just meeting an underlying deficiency that can destabilize the system. But yeah, they help with neuroregulation and increasing the levels of the GABA neurotransmitter. So yeah, sometimes they're looking at
I'm sorry, I
precursors.
apologize.
Yeah.
Do you have favorites? So you have ashwagandha. We've known that for years. You just generally say stress, but ashwagandha, that's got good data on it as something to be a adjunctive therapy to try.
Yeah. The comparison of the people that took it versus not in the study we cite, um, basically their anxiety levels decreased by 1.5 standard deviations. So that would be a significant decrease.
Right. So to use these, you talked about cost. Okay. So if somebody's paying out of pocket for these, I have the chart here. You have ashwagandha, you have some of the cannabinoids, you have saffron, L-theanine, lavender, B6, rhodiola, and lemon balm. Very common ones. Um, so would you encourage people to just take, let's say they had anxiety, one of them and try it, or two or three? You know what I mean? Because if you took 4 or 5 things, you still run up a bill, is what I'm trying to get at, because we were going to cash this money.
There is the issue of cost, and definitely the how the insurance market works. There's some distortion in the markets towards favoring pharmaceuticals. So
none of this will be paid for. I
know
that
you're not going to get this covered. But in general, these are relatively, of course it depends on your supplier. Something like magnesium you can find relatively inexpensive, but some of the other herbs, it might be a bit more difficult to find a source that's both inexpensive and high quality. But the supplements that are common, like L-theanine, you can find quite commonly in most any health food store should have it. Ashwagandha is quite common, and of course magnesium B6. These are all pretty ubiquitous in health food stores. The other elements, rhodiola, Melissa officinalis, or lemon balm, these are a little bit less common. Ideally, the plants, if it's possible, you could grow them. I know that's some people live in apartments and they don't necessarily have access to that, but on a separate point, I think there's possibly there's a market, or at least a potential market, for more natural products.
Oh, there's no question for natural products. But I was thinking that when you said, they could grow their own, if we're talking about anxiety, just going out and people getting in a garden or whatever,
Mhm.
or doing it in their apartment is anti-anxiety producing. That would be something that we would recommend. So I'd say that. I mean, the ones we have in the clinic that we use are ashwagandha. I don't use much saffron, L-theanine, a fair amount, magnesium and B6, rhodiola. Those are the ones that stand out in our clinic that we use a lot of. How about, okay, so I have this chart here. How about um, exercise? Do you have any data or information on exercise and anxiety, that if we got everybody out walking half hour a day or an hour a day, or riding a bicycle, that we would have a lot less anxiety? Any data on that? Because that's free.
Yeah, I don't know. I don't know the precise magnitude of that effect, but it's we don't cover it just because our reviews focused on herbals and
Nutraceuticals.
nutraceuticals. But yeah, there is a significant anti-anxiety effect to that for sure.
How about are there are there different countries? I know, some people. I think it was in the Blue Zone newsletter. It says the happiest places in the world or something like that. But are there countries? I mean, obviously a war-torn country, but are there countries that have I don't know, a social structure or governmental system that tends to breed less anxiety, or is that a non-factor?
Yeah, I'm not too sure about that. I would think that lower crime, that would be greater level of stability, lower crime, lower cost of living relative to average wage. I think these would all be factors, for decreased anxiety, but I haven't seen the data myself.
Uh, Are there any other, so have you used, is there much data on the cannabinoids, I mean, CBD and things like that you feel comfortable with? Because, you can get CBD anywhere, and everybody claims that theirs is, going to make the world perfect. And it's hard to get, a standard, but you have it in your chart here of, you have the cannabinoids here. So I was just wondering what your comments are on those.
Yeah, we include those. There is they do have an anti-anxiety effect from the study that we cite. We don't know much about controlling for quality, if what the effect of that is. So yeah, I don't know much about that.
Right. So it seemed like the best ones there would be ashwagandha, more standardized, L-theanine, magnesium, rhodiola. Okay. Do you have any favorites personally, or do you use any? How do you get rid
Um,
of your anxiety? How do you deal with your anxiety?
well, I take magnesium. Um,
Uh-huh.
sometimes L-theanine. Um,
Hmm.
yeah, if I'm y- y- yeah, I see anxiety. It's an emotion. Um, some people they might be more predisposed to it than others, but at different points in the day we feel different things, and yeah, it's I wouldn't say yeah, I wouldn't say I have an issue with it personally. Um, y- you know, they people say that if you're feeling anxious about something, it can be helpful to reframe that in terms of
Right.
excitement. So, you're anxious because you have an upcoming deadline, or something like that. You can see that as I'm I'm excited, and this is a signal that this is important to me. So yeah, I can use this as fuel.
I understand. All right. Well, when I get anxious, I'll either go out and exercise, or I have a meditation program. I don't usually take a supplement for it, though. I've taken magnesium at nighttime, and I can notice a difference in just getting to sleep faster. Um, All right. Is there any other things you want to add to this topic?
Um, well, not so much an anxiety, but backing up, I think the approach of natural products for chronic diseases, it does solve a lot of issues, like especially during COVID, it came to the forefront that some of the supply chains for pharmaceuticals were, actually quite vulnerable. We had the Suez Canal that was blocked for some time. There was the Houthis taking over the Straits of Hormuz. Um, the Panama Canals that's been stable for some time, but
Well, I got to tell you, it's at risk right now.
oh,
China
okay,
China's building a bridge over it. You know, if you ever want to follow somebody, follow Michael Yon, Yon. He's an ex-Green Beret
oh,
Special
okay. I've,
Forces
I've
guy.
heard of him. Yeah.
Yeah, if you follow him, he goes up the Darien Gap, and he's a world-renowned. I mean, he's been all over the world. He's a combat correspondent, but his specialty is that area, and it's not as stable as people think. We need to stabilize it because you lose any of the routes, so to speak. He talks about stabilities in countries and routes, and if you block off the Suez Canal, we could have gas prices soar up. If you block off the Panama Canal, it's that's where things happen. So you might follow him. I think you'll find it very challenging and fascinating. But he's right there. He goes all over the world.
Okay,
So
yeah, I love geopolitics, but
yeah,
yeah,
so do I. So trust me, he's really good on international migration. He cuts to the chase. Um, well, okay, this is good. I had some anxiety getting ready for this. I always do, but I always think of it as good now. Um, when I have anxiety before, you want to have a good interview and things like that. Um, and I'm talking to somebody I've never talked to before or whatever. Uh, I just image it's going to turn out to be great, and the emotion of that, and the emotion of yeah, it's going to be a great interview, and put that out there because everything is an energy and a frequency. Your thoughts and emotions got to come from somewhere. And so, well, you're the quantum physics guy or the physics guy, excuse me. But most of some very heavyweight the meditation group that or some studies I did because I had colon cancer, and so part of my year last year was going to intensive meditation seminars, and the conversation was really about quantum physics and energy and frequency. You know, and so what you put out there in your thoughts and emotions affect something. And I really believe that. So anyway, this has been great. So I really appreciate you taking the time. I'm kind of envious. I kind of like to hop over on the other side of the screen and see what's happening on Honduras. Um, I haven't been to Central America in quite a few years. So, but it's good there, right? Is living there good?
yeah. It's the weather's nice. Yeah, it's great.
Thank you for taking the time out today. I will look for your articles in the future. Maybe we can talk about how you grade reactions to the vaccines. You were coming up with a different system besides VAERS, if I recall right.
Yeah, so basically, it gives you reports, but it doesn't give you rates with a denominator. So for a while, we didn't have the dose data to actually, compare what's the number of adverse event reports per million doses administered.
Mhm.
But that we got hold of there was the CDC released it early. It was early this year or late last year, where they released all the dose data. So we put that together with VAERS to calculate the per dose rate of adverse events, deaths for all the vaccines, as well as the top 250 most commonly prescribed drugs in the USA. So we're hoping that can be a resource for further science, pharmacovigilance. It's published in the journal Pharmacoepidemiology.
I think I came across it. That's why I brought it up. Okay. All right. Well, thank you for taking the time so much. And hopefully we'll chat again soon, or maybe we'll meet in person sometime soon.
Yeah, I'd love to. Thank you, Kirk.
All right. And I'd like to thank the audience for listening to this edition of the Staying Healthy Today show. Until next time, stay and be well.